Blood. Blood is a bodily fluid that circulates through the heart, arteries, veins, and capillaries to transport oxygen and nutrients to the body's cells and remove waste products. It is made up of plasma, red blood cells, white blood cells, and platelets. Blood plays a vital role in the body's ability to fight infection and disease, and disorders of the blood can have serious consequences for a person's health. Function of blood in the body. The main function of blood in the body is to transport oxygen and nutrients to the body's cells, and remove waste products. Blood circulates through the heart, arteries, veins, and capillaries, and is responsible for oxygenation of body cells. Blood carries oxygen from the lungs to the body's cells, where it is used to produce energy. Nutrient delivery. Blood also carries nutrients, such as glucose and amino acids, to the body's cells. Waste removal. Blood helps to remove waste products, such as carbon dioxide and urea, from the body's cells. Regulation of body temperature. Blood helps to regulate body temperature by carrying heat away from the core of the body to the skin's surface, where it can be dissipated. Protection. Blood also plays a crucial role in the body's immune system, as it carries white blood cells that help to fight infection and disease. Coagulation. Blood also helps in coagulation or clotting, which is necessary for injury healing and to prevent bleeding. Hormone transport. Blood transports hormones, chemical messengers that help to regulate various bodily functions, to different parts of the body. Main components of blood. The main components of blood are plasma. Plasma is the yellowish liquid component of blood, making up about 55% of total blood volume. It is mostly water and contains dissolved substances such as hormones, nutrients, waste products, and gases. Red blood cells, erythrocytes. Red blood cells are responsible for carrying oxygen to the body's cells. They are biconcave in shape and contain the protein hemoglobin, which binds to oxygen. White blood cells, leukocytes. White blood cells are part of the body's immune system and help to fight infection and disease. There are several types of white blood cells, including neutrophils, lymphocytes, and monocytes. Platelets, thrombocytes. Platelets are small, irregularly shaped cells that play a crucial role in blood clotting. They stick together to form a clot and help to stop bleeding from a wound. Other components. Blood also contains various other substances, including electrolytes such as sodium, potassium, and calcium, hormones, and enzymes. How is blood formed and produced in the body? Blood is formed and produced in the body through a process called hematopoiesis. Hematopoiesis occurs mainly in the bone marrow, the spongy tissue found inside certain bones. The process begins with the formation of hematopoietic stem cells, immature cells that have the ability to develop into all types of blood cells. These stem cells mature into the different types of blood cells: erythrocytes, red blood cells, leukocytes, white blood cells, and thrombocytes, platelets. Red blood cells are produced in large numbers and are responsible for carrying oxygen throughout the body. They are produced in the red bone marrow of flat bones, such as the sternum, pelvis, and vertebrae. White blood cells are produced in smaller numbers and are responsible for fighting infection and disease. They are produced in the red bone marrow of flat bones and in lymphoid organs such as the thymus and the spleen. Platelets are also produced in the bone marrow and are important for blood clotting. The production of blood cells is regulated by various hormones and growth factors, such as erythropoietin and thrombopoietin. The production of blood cells can be affected by various medical conditions and diseases, such as cancer and bone marrow disorders. Difference between arterial and venous blood. Arterial blood and venous blood are two different types of blood that have distinct characteristics and functions. Oxygen content. Arterial blood is oxygen-rich blood that is pumped out of the heart and into the body's tissues through the arterial system. It contains a high concentration of oxygen, which is necessary for the body's cells to produce energy. Venous blood, on the other hand, is oxygen-poor blood that is returned to the heart from the body's tissues through the venous system. It contains a lower concentration of oxygen. Carbon dioxide content. Arterial blood contains a lower concentration of carbon dioxide compared to venous blood, as it carries carbon dioxide from the body's cells to the lungs, where it can be exhaled. Venous blood, on the other hand, contains a higher concentration of carbon dioxide as it carries carbon dioxide that was not removed in the capillaries back to the lungs. Color. Arterial blood is usually bright red in color due to its high oxygen content, whereas venous blood is usually darker red in color due to its lower oxygen content. Pressure. Arterial blood is under higher pressure than venous blood, due to the pumping action of the heart. This high pressure is necessary to push the blood through the body's tissues and into the capillaries, where the exchange of oxygen and nutrients takes place. Function. Arterial blood provides oxygen and nutrients to the body's cells, and venous blood carries away waste products such as carbon dioxide and urea to be eliminated from the body. Different types of blood cells and their functions. There are three main types of blood cells: red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes. Red blood cells, erythrocytes. Red blood cells are responsible for carrying oxygen to the body's cells. They are biconcave in shape and contain the protein hemoglobin, which binds to oxygen. They make up about 40 to 45% of total blood volume. White blood cells, leukocytes. White blood cells are part of the body's immune system and help to fight infection and disease. There are several types of white blood cells, including neutrophils. They are the most common type of white blood cells and are responsible for fighting bacterial infections. Lymphocytes. They are responsible for the immune response to viral infections and cancer cells. Monocytes. They act as scavengers, ingesting foreign particles and cellular debris. Eosinophils. They help to fight parasitic infections and are involved in allergic reactions. Basophils. They release histamine, a chemical that helps to fight infection and promote inflammation. Platelets, thrombocytes. Platelets are small, irregularly shaped cells that play a crucial role in blood clotting. They stick together to form a clot and help to stop bleeding from a wound. They are important for injury healing. All these cells are produced in the bone marrow, and their production is regulated by various hormones and growth factors. Blood cell counts can provide important information about a person's health and can help to diagnose and monitor various medical conditions. Role of blood in the immune system. Blood plays a crucial role in the body's immune system, as it carries white blood cells that help to fight infection and disease. The immune system is a complex network of cells, tissues, and organs that work together to protect the body against foreign invaders, such as bacteria, viruses, and cancer cells. White blood cells are responsible for fighting infection and disease. They are produced in the bone marrow and are released into the bloodstream, where they circulate throughout the body, looking for foreign invaders. White blood cells include neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Each type of white blood cell has a specific role in the immune response. Neutrophils are the most common type of white blood cell and are responsible for fighting bacterial infections. Lymphocytes are responsible for the immune response to viral infections and cancer cells. Monocytes act as scavengers, ingesting foreign particles and cellular debris. Eosinophils help to fight parasitic infections and are involved in allergic reactions. Basophils release histamine, a chemical that helps to fight infection and promote inflammation. The immune system also includes specialized cells and proteins, such as antibodies and complement proteins, that work together to help the white blood cells fight infections. Blood also plays a role in the transportation of immune cells and molecules to the site of infection or injury. Blood also provides a means for the immune system to communicate with other parts of the body through cytokines, signaling molecules that help in the communication of immune cells with other cells in the body. Overall, the immune system is a complex and dynamic network that is constantly monitoring and responding to potential threats to the body's health, and blood plays a vital role in this process. How does blood help to regulate body temperature? Blood plays an important role in regulating body temperature through a process called thermoregulation. Thermoregulation is the ability of the body to maintain a consistent internal temperature, which is necessary for optimal function of the body's enzymes and metabolic processes. Blood helps to regulate body temperature by carrying heat away from the core of the body to the skin's surface, where it can be dissipated. This is known as heat dissipation. When the body's temperature rises, the blood vessels in the skin's surface dilate, allowing more blood to flow close to the surface of the skin. This increased blood flow carries the heat away from the core of the body and releases it into the environment through the skin's surface. When the body's temperature falls, the blood vessels in the skin's surface constrict, reducing the amount of blood flow close to the surface of the skin. This helps to conserve heat and maintain the body's internal temperature. Sweating is another way that the body cools down by evaporation of water from the skin. When you sweat, it cools down the blood vessels in the skin and decreases the body temperature. The hypothalamus, a small area in the brain, acts as the body's thermostat, monitoring the body's temperature and sending signals to the blood vessels in the skin to constrict or dilate as needed to maintain a consistent internal temperature. Overall, blood plays a key role in maintaining a consistent internal temperature, which is necessary for the body to function properly. The normal levels of different blood cells and substances. Normal levels of different blood cells and substances can vary depending on a person's age, sex, and overall health. However, there are generally considered to be normal ranges for many of these components, which can be used as a reference for measuring and interpreting the results of a blood test. Red blood cells, erythrocytes. The normal range for adult men is 4.7–6.1 million cells per microliter (mcl) of blood, and for adult women is 4.2–5.4 million cells per mcl. White blood cells, leukocytes. The normal range for adult men and women is 3.5–10.5 thousand cells per mcl. Platelets, thrombocytes. The normal range for adult men and women is 150 to 450,000 cells per mcl. Hemoglobin. Hemoglobin is a protein found in red blood cells that carries oxygen. The normal range for adult men is 13.5–17.5 grams per deciliter (gram per deciliter), and for adult women is 12.0–15.5 grams per deciliter. Hematocrit. Hematocrit is the percentage of red blood cells in the total blood volume. The normal range for adult men is 40 to 54%, and for adult women is 37 to 47%. Other components. Different tests can measure the level of other components in blood such as glucose, electrolytes, lipids, hormones and enzymes, each with its own normal range, depending on the test and the context. It's important to note that these ranges are general references, and that normal values can vary depending on the laboratory or facility that performs the test, as well as the specific method used. Additionally, normal levels may vary depending on the individual's age, sex, and overall health. Consultation with a doctor is necessary to interpret the test results in relation to an individual's health condition. What are some common blood disorders and diseases? There are many different types of blood disorders and diseases. Some of the most common include anemia. Anemia is a condition in which there is a deficiency of red blood cells or hemoglobin in the blood, resulting in a lack of oxygen to the body's cells. The most common types of anemia are iron deficiency anemia, caused by a lack of iron in the diet, and pernicious anemia, caused by a lack of vitamin B12. Leukemia. Leukemia is a cancer of the white blood cells, which can affect the body's ability to fight infection and disease. It can be either acute or chronic. Hemophilia. Hemophilia is a genetic disorder that affects the blood's ability to clot. People with hemophilia have a tendency to bleed excessively, even from minor injuries. Thrombocytopenia. Thrombocytopenia is a condition in which there is a deficiency of platelets in the blood, which can lead to easy bruising and bleeding. Hemolytic anemia. Hemolytic anemia is a condition in which red blood cells are destroyed faster than they can be produced, which can lead to a lack of oxygen to the body's cells and a buildup of bilirubin in the blood. Polycythemia. Polycythemia is a condition in which there is an excess of red blood cells in the blood, which can lead to thickening of the blood and increased risk of clotting. Sickle cell anemia. Sickle cell anemia is a genetic disorder in which the red blood cells are abnormally shaped and can block blood vessels, leading to pain and organ damage. Hematological malignancies. Lymphomas and multiple myelomas are examples of blood cancer that affect white blood cells or plasma cells, respectively. These are just a few examples of the many different types of blood disorders and diseases that can affect a person's health. Many of these disorders and diseases can be treated, and some can be prevented, but early detection and prompt treatment are essential for the best outcomes. How is blood tested and analyzed? Blood testing and analysis is a common diagnostic procedure that can provide important information about a person's health. There are many different types of blood tests that can be performed, each with its own specific purpose. Complete blood count (CBC). A CBC is a common blood test that measures the number and types of cells in the blood, including red blood cells, white blood cells, and platelets. It also measures the amount of hemoglobin in the blood and hematocrit, which is the percentage of red blood cells in the total blood volume. Blood chemistry tests. Blood chemistry tests measure the levels of various substances in the blood, such as glucose, electrolytes, lipids, enzymes, and hormones. These tests can provide information about a person's liver and kidney function, metabolism, and other aspects of their health. Blood coagulation tests. Blood coagulation tests measure the time it takes for the blood to clot and the ability of the blood to clot properly. These tests can be used to diagnose and monitor bleeding disorders, such as hemophilia. Blood culture. Blood culture is a test that is done to detect the presence of microorganisms, such as bacteria and fungi, in the blood. This test is usually done when the person has signs of sepsis or when there is a suspicion of a bloodstream infection. Blood typing and cross-matching. Blood typing and cross-matching tests are used to determine a person's blood type and to make sure that the blood that is to be transfused is compatible with the person's blood type. Immunological tests. Blood tests that measure the levels of various immune system components such as antibodies, complement proteins and cytokines. Molecular diagnostics. blood tests that detect genetic mutations, such as the presence of BRCA1 or BRCA2 genes that are associated with increased risk of breast cancer. These are just a few examples of the many different types of blood tests. Different blood groups and their significance. Blood groups refer to the different types of antigens, proteins and sugars that are found on the surface of red blood cells. The most important blood groups are the ABO and the Rh rhesus blood group systems. ABO blood group system. The ABO blood group system is the most important blood group system and has 4 blood types, A, B, AB, and O. These blood types are determined by the presence or absence of certain antigens on the surface of red blood cells. Type A blood has A antigens on the surface of red blood cells. Type B blood has B antigens on the surface of red blood cells. Type AB blood has both A and B antigens on the surface of red blood cells. Type O blood has no A or B antigens on the surface of red blood cells. Rh rhesus blood group system. The Rh blood group system has 2 blood types, Rh positive and Rh negative. This blood group is determined by the presence or absence of a protein called the Rh factor on the surface of red blood cells. Rh positive blood has the Rh factor on the surface of red blood cells. Rh negative blood does not have the Rh factor on the surface of red blood cells. It's important to know your blood type in case of a need for a blood transfusion, because if a person receives incompatible blood, it can cause serious health problems or even death. Blood type compatibility is determined by the presence or absence of certain antigens on the surface of red blood cells. How does blood clotting work? Blood clotting, also known as coagulation, is a complex process that occurs in the body to stop bleeding from a wound or injury. When a blood vessel is damaged, platelets and clotting factors in the blood work together to form a clot, which stops the bleeding and helps to repair the damaged vessel. Platelets are small, irregularly shaped cells that are essential for blood clotting. When a blood vessel is damaged, platelets stick together and form a plug at the site of the injury. The clotting cascade. The clotting cascade is a series of chemical reactions that are triggered when a blood vessel is damaged. These reactions involve a number of clotting factors, including factor VIII, factor IX, factor X, factor XI, factor XII, fibrinogen. Activation of clotting factors. Activation of clotting factors leads to the formation of fibrin, a protein that forms a mesh-like structure that traps red blood cells and platelets to form a clot. Clotting factors are activated in a sequential and regulated manner, which is called the intrinsic and extrinsic pathway. Once the clot is formed, it will begin to contract, which helps to pull the edges of the wound together, and a process called fibrinolysis will break down the clot to prevent excessive clotting. Blood clotting is a complex process that involves many different clotting factors, platelets and other cells, and is regulated by various proteins and hormones. Abnormalities in any of these components can lead to bleeding or clotting disorders such as hemophilia, von Willebrand disease, or thrombophilia. Overall, blood clotting is an essential process that helps to stop bleeding and repair damaged blood vessels, but it is also regulated to prevent excessive clotting, which can lead to serious health problems. What is anemia and what are its causes? Anemia is a condition in which there is a deficiency of red blood cells or hemoglobin in the blood, resulting in a lack of oxygen to the body's cells. Anemia can have a wide range of causes, and it can affect people of all ages and genders. Iron deficiency anemia. Iron deficiency anemia is the most common type of anemia and is caused by a lack of iron in the diet or by blood loss. Iron is necessary for the production of hemoglobin, which carries oxygen in the blood. Vitamin deficiency anemia. Vitamin B12 and folate deficiency anemia can also cause anemia. Vitamin B12 and folate are essential for the production of red blood cells. Chronic disease. Chronic diseases such as kidney disease, cancer, or rheumatoid arthritis can also cause anemia by reducing the body's ability to produce red blood cells. Blood loss. Blood loss, whether it is acute or chronic, can cause anemia. Blood loss can occur due to injury, surgery, heavy menstrual periods, or other medical conditions such as ulcers or cancer. Bone marrow disorders. Certain bone marrow disorders can also cause anemia by reducing the body's ability to produce red blood cells. Examples of these disorders include aplastic anemia, myelodysplastic syndromes, and leukemia. Hemolytic anemia. Hemolytic anemia occurs when red blood cells are destroyed faster than they can be produced. This can be due to genetic disorders, autoimmune disorders, or certain infections. These are some of the most common causes of anemia. What is blood pressure and how is it regulated? Blood pressure is the force exerted by the blood against the walls of the blood vessels as it flows through the body. It is measured in millimeters of mercury mmHg and is expressed as two numbers: systolic pressure, the highest pressure when the heart beats, and diastolic pressure, the lowest pressure when the heart is at rest between beats. Blood pressure is regulated by the balance between the amount of blood the heart pumps and the resistance of the blood vessels to the flow of blood. The heart pumps blood into the blood vessels with each beat, creating the systolic pressure. Between beats, the heart is at rest and the pressure in the blood vessels is the diastolic pressure. Blood vessels are able to constrict and dilate in response to changes in blood pressure, which helps to regulate blood pressure. This is controlled by the sympathetic and parasympathetic nervous system, which affect the tone of the blood vessels. The renal system also plays an important role in regulating blood pressure by controlling the amount of fluid in the body, which affects the volume of blood in the blood vessels. The kidneys produce the hormone renin, which triggers the production of another hormone called angiotensin II. This hormone causes the blood vessels to constrict, which increases blood pressure. The kidneys also control the amount of sodium and potassium in the blood, which can affect blood pressure. High levels of sodium can cause the blood vessels to constrict, raising blood pressure, while high. What are the risks and benefits of donating blood? Donating blood can have both risks and benefits for the donor and for the recipients. Benefits for donors. Donating blood can help to save lives by providing a vital resource for people who need blood transfusions. Donating blood can also help to improve the health of the donor by reducing the risk of heart disease and cancer. Donating blood can also be a way for donors to give back to their community and make a positive impact on the lives of others. Risks for donors. Some people may experience lightheadedness or fainting after donating blood. There may also be some mild discomfort or pain at the site of the needle insertion. Some donors may also experience a slight drop in iron levels after donating blood. Benefits for recipients. Blood transfusions can save lives by providing a vital resource for people who need it. Blood transfusions can also help to improve the health of recipients by providing them with the necessary red blood cells and other components they need. Risks for recipients. There is a small risk of infection or other complications associated with blood transfusions. There is also a risk of an allergic reaction or an adverse reaction to the blood transfusion. Additionally, there's a slight risk of receiving the wrong blood type, which can lead to serious health problems or death. Overall, donating blood can be a safe and beneficial experience for both the donor and the recipient, How is blood transfused from one person to another? Blood transfusion is a medical procedure in which blood or blood components are transferred from one person, the donor, to another person, the recipient. The process of blood transfusion involves several steps to ensure that the blood is safe to use and compatible with the recipient's blood type. Screening and testing. The first step in the process of blood transfusion is to screen and test the blood to ensure that it is safe to use. This includes testing the blood for infectious diseases such as HIV and hepatitis, as well as cross-matching the blood to make sure that it is compatible with the recipient's blood type. Collection and preparation. Once the blood is screened and tested, it is collected and prepared for transfusion. Whole blood, which contains red blood cells, plasma, and platelets, can be collected from a single donor. Also, specific blood components such as red blood cells, platelets, plasma, or cryoprecipitate can be collected and prepared from different donors. Transfusion. After the blood is collected and prepared, it is transfused into the recipient through an IV. A sterile tubing is inserted into a vein in the arm of the recipient and the blood is slowly infused into the bloodstream. Monitoring. The recipient will be closely monitored during and after the transfusion to make sure that there are no adverse reactions to the transfusion. Follow-up. After the transfusion, the recipient will be given instructions on how to care for themselves and will be advised to report any symptoms or problems that may occur after the transfusion. Blood transfusion is considered a safe medical procedure, but as with any medical procedure, there is a small risk. Role of blood in cancer. Cancer can affect the blood in several ways, and the role of blood in cancer is complex. Some of the ways in which blood is involved in cancer include metastasis. Cancer cells can travel through the bloodstream and lymphatic system to form secondary tumors in other parts of the body, a process called metastasis. This is how cancer can spread to other parts of the body from the primary tumor. Blood vessel formation. Tumors need blood vessels to grow, and cancer cells can stimulate the formation of new blood vessels, a process called angiogenesis, which allows the tumor to obtain the oxygen and nutrients it needs to grow. Blood cell production. Some cancers, such as leukemia and lymphoma, affect the blood cells directly by forming in the bone marrow, where blood cells are produced. These cancers can lead to anemia, bleeding, and an increased risk of infection. Blood clotting. Some cancers can increase the risk of blood clots, which can lead to serious health problems such as deep vein thrombosis (DVT) and pulmonary embolism. Blood markers. Some cancers produce substances that can be detected in the blood, such as cancer-specific proteins or tumor-associated antigens. These markers can be used to help diagnose cancer and to monitor a patient's response to treatment. Blood count changes. Some cancer treatments can affect the number of blood cells, which can lead to anemia. Effects of drugs and alcohol on the blood. Drugs and alcohol can have a variety of effects on the blood, including alteration of blood cell counts. Alcohol consumption can cause a decrease in the number of red blood cells, white blood cells, and platelets, which can lead to anemia, increased risk of infection, and bleeding. Some drugs, such as chemotherapy and radiation, can also affect blood cell counts. Changes in blood clotting. Alcohol consumption can increase the risk of blood clots, which can lead to serious health problems such as deep vein thrombosis and pulmonary embolism. Certain drugs, such as blood thinners, can also affect blood clotting. Alteration of blood pressure. Some drugs and alcohol can affect blood pressure by constricting or dilating blood vessels. This can lead to high or low blood pressure, which can increase the risk of stroke or heart attack. Liver damage. Alcohol consumption and certain drugs can damage the liver, which can affect the body's ability to produce blood clotting factors and remove toxins from the blood. Effects on the immune system. Some drugs and alcohol can suppress the immune system, which can increase the risk of infection. Effects on blood sugar. Alcohol and certain drugs can affect blood sugar levels, which can lead to diabetes or hypoglycemia. Effects on blood vessels. Alcohol and certain drugs can cause inflammation and damage to the blood vessels, which can lead to heart disease and stroke. It's important to note that the effects of drugs and alcohol on the blood can vary depending on the type of drug or alcohol, the amount consumed, and the individual's overall health. It's important to consult a healthcare professional before consuming drugs or alcohol and to follow the recommended dosages. Improve your blood health through diet and lifestyle. There are several ways to improve blood health through diet and lifestyle changes. Eat a balanced diet. Eating a diet that is rich in fruits, vegetables, whole grains, lean protein, and healthy fats can help to improve blood health by providing the necessary nutrients for the production of red blood cells, platelets, and clotting factors. Maintain a healthy weight. Being overweight or obese can increase the risk of high blood pressure and other blood-related health problems. Losing weight through healthy eating and regular exercise can help to improve blood health. Exercise regularly. Regular physical activity can help to improve blood flow and lower the risk of high blood pressure and other blood-related health problems. Limit alcohol consumption. Excessive alcohol consumption can damage the liver and increase the risk of high blood pressure and other blood-related health problems. Don't smoke. Smoking can damage the blood vessels and increase the risk of high blood pressure, heart disease, stroke, and other blood-related health problems. Manage stress. Stress can have a negative effect on blood health, so it's important to find ways to manage stress through relaxation techniques, such as meditation, yoga, or deep breathing. Get enough sleep. Getting enough sleep is important for overall health, including blood health. Lack of sleep can increase the risk of high blood pressure and other blood-related health problems. Keep track of your health. It's important to keep track of your blood pressure, cholesterol and blood sugar levels, especially if you have a family history of blood-related health problems or if you have other risk factors for these conditions. Remember, making these changes to your diet and lifestyle can help improve your overall health and well-being, including your blood health. It's also important to consult a healthcare professional before making any significant changes to your diet or lifestyle.